We have to find real solutions, and this is Bending the Trend. Hello, and welcome back to Bending the Trend with your host, Norm Volsky, where we're fighting rising healthcare costs. And we are very excited to be joined by Jake Frankel, who is founder of ASF Strategies. Jake, welcome to the pod, and we're excited to learn from you.
Thanks, man. I appreciate it.
Yeah, absolutely. So I think what's interesting about your background is, now you've founded your own consultancy, but you've also been a director of benefits. You're a director of benefits at Goldner Capital Management. So you kind of sat on both sides of the fence, which is one of the big reasons we were really excited, to get your insights. So first off, wanted to ask, what are the best vendors or strategies you've implemented that you would recommend to your peers?
So I break down strategies in a couple different ways. My favorite ones are the ones that employees don't even know about. So the best thing that I know, and I'll speak from the mid-market perspective.
Please. And what do you consider mid-market? Again, everyone has a different
mid-market, anywhere from 100 or 150 and up to probably around 5,000.
Okay. So there's some self-insured in that area.
Yeah. There's definitely self-insured in that area. And there's a lot that you could do with companies those sizes. But the best thing that I know that doesn't touch the employee would be purchasing stop loss more efficiently.
Mm-hmm.
And to me, the best way to do that is through the complete captive, MedTrans with complete captive.
Mm-hmm.
That by far is the most efficient way to purchase stop loss. And then there's other things that you could do that don't touch the employee, like payment integrity. So we're working with Quantify. There's a lot of other good ones for payment integrity. It's probably not so hard to do, once you're not taking like massive volumes of claims and you have to auto adjudicate some, and you could really just get a handle on the really big outlier claims. So those are my favorites. Those are the low hanging fruit solutions. The next category are what you would call point solutions.
Mm-hmm.
And then those can be broken down, I think, by reimbursement-focused strategies
Mhm.
and clinical support strategies and access. So, how are we directing patients to get high-cost drugs at lower prices? RBP, how are we controlling the cost of care for inpatient care?
All of our viewers and listeners, RBP is reference-based pricing.
Yeah, reference-based pricing. That could be done in a couple different ways. Basically, reference-based pricing is where you reimburse either at a percentage of Medicare, what Medicare would typically pay, just to level set what the reimbursement is. So you don't go like down the street and it's like, I don't know, 2x what you would be paying at the hospital,
RBP companies are trying to end up somewhere between like flat, like exactly Medicare rates,
Well, I
up
would
to
say
maybe
probably like
up to
140,
50%.
Yeah. And kind of that model is shifted a little bit to more of like a cost to charge ratio, where you'll find out what the cost of care is for a given service and then just build in margin, so that the hospital is not being underpaid. So really, really, powerful reimbursement tool. Also just, there's so many great direct contracting vendors out there that control the cost of care. Fair market.
Any that you've worked with?
Fair market health is a model that I really, really like. Lantern obviously is, a model that's really, really fantastic. Quantify Infusion for infusion therapy. There's a lot of great reimbursement focused strategies.
Carum and Leap are also vendors in that market. Carum kind of competing with Lantern as well as Leap, is kind of in that infusion, or squarely in that infusion market. Another area I'm really excited about is radiology and One Imaging.
Yeah.
They did 52 implementations of jumbos in January this month alone. So I'm really excited to get some of the cost savings data there. Like, I think they're going to save the healthcare system hundreds of millions.
Radiology I think is great. The difference between radiology and, let's say, infusion therapy and elective procedures is that imaging touches more of the employee base. So you need to get much greater penetration. It's just much easier to work with the smaller number of people that require infusions and elective procedures.
For sure.
So I mean, that's sort of where you're like working around the margin and controlling the cost of like those high unit cost of care episodes. I
For
just want to highlight one more vendor.
please,
That's like in the next category. That's the care support. Aligned Health Marketplace. One thing
big
that
fan of Patrick and team.
yeah, one thing that networks don't do well is advanced primary care.
Hmm.
So what they started out doing was layering on value-based arrangements with providers that your employees are already seeing through ACO partnerships, and also providing additional capitated arrangements, like what you see from DPCs. But what I see that they're going to transition to is flipping the healthcare system on its head, where typically what you see is like hospitals go downstream and invest in like the primary care after the acute care. What they're going to do is flip it. They're starting with primary care and then redirecting to value-based specialty everywhere else. So that I'm really excited about.
I like it.
There's one more vendor that has done really good work with me, Walrus. Walrus basically provides all of our employees with their personal clinical pharmacist. I remember I had one employee that was on 15 different medications and didn't know how to manage them all. So we linked them up with a clinical pharmacist, and they were able to just walk them through and provide really, really great support.
Yeah, and
Uh,
what I love about Walrus, Kimball's good friend, I believe has been on the podcast before, if I'm not mistaken. I definitely believe that, yeah, when people are taking a lot of different pharmaceuticals, the chances of a drug interaction that
yeah,
result in a negative side effect are very, very high.
right.
And guess what? When patients aren't feeling their best, they start to say, you know what, like, is it really worth taking this pill? I really feel like crap every day when I take them. So to get someone on a combination of drugs that achieve the long-term clinical outcome you want, which is, warding off chronic disease, but also there's no side effects and symptoms, you're able to increase medication adherence drastically, which also is going to increase your savings long term because it's easier to manage chronic condition when people are taking their drugs. That
But it's also just not that hard to generate ROI on it because it just
agreed.
takes one or two over the course of 2 years to make a return on investment.
Yep. And walk me through the impact, of some of these implementations.
Well, I mean, the shopping stop loss more effectively doesn't
Cost
have much
savings.
impact on, yeah. I mean, that just has crazy cost savings long term. I think historically, payment integrity vendors at the high dollar claim level typically generate 7 to 12% in cost savings. And then kind of like aligned, we're at like a vibes on investment type of deal at this point, but just having the ability to tell employees that they could go to their primary care provider and there's a quarterback coordinating their care that's receiving data even when they're not going to the primary care doctor, they just know about it, is a really big deal. Same thing on Walrus. If you're able to provide support to these polychronic members, it's just a really big deal and something that doesn't exist in many other markets.
Yeah, it's fantastic. And what would you say you and your clients' biggest challenges are that you would love to solve, but you haven't identified a vendor that does that particular thing yet? We're
Um,
trying to incentivize and maybe inspire the next group of entrepreneurs to fix problems that all of us are struggling with.
there's so many solutions out there. What I think is really lacking is marketing to employees. Like when something comes up, they know what's available, they know how things work. And really, I think just a better way to market to employees what the plan truly offers and how to generate just positive regard for what the employer is trying to do for them.
This was filmed January of 2026. I did not ask or pay Jake to ask that or say that. And there might be a solution for that in the not too distant future. Just keep your eyes peeled over the next couple of months.
Okay. Looking forward to hear about it.
Any other advice just to benefits leaders or consultants that are really looking to curb trend and, save dollars, get better value, for their healthcare dollars?
I would say really, really dig into the technical details of any point solution or any solution that you're talking to, because I think the more detail you have around how the vendor needs to work, whether it's data going back and forth with the TPA or the administrator to outreach to clients and like what that looks like, the more you can anticipate some of the issues that'll arise. And
Gotcha.
then you can sort of filter out who you would want to work with versus who you don't.
I love it. Well, great advice. Thank you for your advice and sharing your insights on how employers can get better value for the dollars they're already spending. And appreciate all you're doing to fight rising healthcare costs. And keep doing the great work, Jake. Really appreciate it.
Yeah, I appreciate you having me.
Thank you. Thanks for watching Bending the Trend, where we are looking to fight rising healthcare costs. We are asking benefits leaders what digital health solutions they've implemented that has helped them bend the trend.